Hello, it's wonderful to meet you. My name is Dr. Hastings, and I understand that you have been referred to us by your GP as you've been experiencing neck pain and headaches. Is that right? Well, I have your notes from your GP here, but could you just briefly describe to me, in your own words, your experience so far? And have you experienced anything like this before? So this is a recent ailment. All right. Yes. When did that start? All right. And just to clarify, you haven't had any investigative work or any tests or any scans done for your neck in the last 12 months. All right. So thank you so much for elaborating on your experience. I do need to ask you a few more in-depth questions just to sort of flesh out the information that you gave me and get an overall picture of your neck and the pain that you're experiencing at the moment. All right. So let's start with the neck area first of all. So you said that the pain sort of radiates from the bottom portion of your neck all the way up to where it meets the skull there. Can you tell me if you experience this type of pain all the time, or do you experience other locations of pain from time to time? Okay, so you would say it's quite limited to that area. Okay, well, I'll make a note of that. It goes down to the shoulders. Along the shoulders here, can you just point to me where you mean? Alright. And the depth of pain, how would you describe that? So would you say it's a very light, superficial kind of a pain, or would you say it goes deeper than that? Right down to almost like the deeper levels of the muscles. Some people say right down to the bone. Alright, so if we use a scale, low, which means that the depth of pain is quite shallow in a sense that it doesn't have that depth to it. Medium is kind of somewhere in between, and high is very deep pain. Okay. And would you say that the pain is sharp and stabbing, or would you say the pain is more dull and sort of lingering? Do you get any pins and needles or numbness or any tingling in that area or the surrounding areas? Okay. So would you say that happens quite frequently? Alright. And does anything make the pain in your neck worse at all? Yes, okay, that's quite a common one. Okay, and what do you find makes the pain better? It can be posture, some physical movements, any medications. Would you say that you rely on those to ease the pain in your neck? And how many of those do you take a day? Okay. Yes, no, that's fine. Alright, thank you very much. So now we move on to the headache portion. Much the same as before. Where would you say when you experience headaches the pain is roughly located. You can just point to them. Okay, and would you say that every time you have a headache, it locates in that area, or does it kind of move about from time to time? Okay. And where else do you experience the headaches, would you say? Okay. Okay. And again, the depth of pain on a scale of low, medium, and high, the depth of pain of the headaches, how would you describe them? And would you say that when you have the neck pain, the headache is soon to follow? So one doesn't start without the other, and vice versa. Okay. And is the type of pain in your head sharp or dull? Okay. I see, so from time to time they are intermittent. Okay. And any pins and needles, numbness or tingling in your face? Okay. Any blurred vision or flashing lights in the eyes? Any tinnitus or ringing in your ears? Okay. And does anything make the pain in your head worse? Okay. Okay. And does anything make it better? Again, any physical movements, relaxation, medication? And again, how many of those do you take? And do you take them just when you're experiencing the headache? All right. Do you experience any dizziness or nausea when you have your headaches? Okay, time to time. Any loss of balance or falling over? Okay. And how many headaches would you say on average you have per week? Per day, okay. And how long do they last roughly? If, say, you weren't going to take any medication or provide yourself with any relief, how long would they last for? Okay. Does this have an effect on your day-to-day activity? I see. And how severe would you say the headaches are? Like I say, you've said that it sometimes has an effect on your day-to-day activity, but has it ever got to the point where you're incapacitated, you physically can't move? All right. But that didn't happen, it only happened the one time. Okay. Perfect, thank you very much. So now, a couple of questions about your lifestyle, routine, and habits. Could you just, in your own words, very briefly describe to me your morning routine from the time you get up to the time you sort of go to work? Right. Is that every morning? Okay, so it varies. Perfect. And now from the time, throughout the day you're at work, just describe to me your sort of daytime activities. So would you say you spend a lot of time there? Okay. And now just briefly explain to me, when you get home from work, and to the point where you go to bed. Just explain your routine there. Yes. Are there any other people in your household that you have to provide for? Okay. All right. And again, any variations to that routine at all? All right. And in terms of exercise, you did briefly mention a little bit in your daily routine, but do you exercise on a regular basis, and do you do specific exercises like running or weightlifting or swimming? Okay. Yes. All right, so pretty full on. All right. Do you experience the headaches and the neck pain whilst you're asleep at night? Does it wake you up? I see. Okay. And could you just describe your general activities in terms of your hobbies, things that you like to do for recreation or pleasure? Okay. Perfect. And you said you worked at a computer. How many hours a day do you think roughly you spend at the computer, both at work and at home? Okay. And what's your desk and chair like at work? How would you describe it? I see. Perfect. And your pillows when you go to bed at night, could you describe the material, the softness, how many pillows you have, etc.? Yes. I see. And do you find that's quite uncomfortable? Okay. And how would you describe your general health at this moment? Alright. Are you undergoing any treatments for any underlying health conditions? Okay. Okay. And when was the last time you visited your opticians? And do you need or wear glasses? Okay. And that's perfect. I think I have everything that I need. And aside from the medications that you told me about for your head and neck pain, are you on any other medications at all? Okay. Okay, perfect. So that's the last question. I have everything here. Perfect. So if I could ask you to just remove your outer layer, your outer top, you can leave anything that you're wearing on underneath. I just need to be able to see your neck fully and the top of your shoulders fully. And if you can just move it to a position that's comfortable for you, where you can actually move your arms above your head without being restricted, that would be perfect. And if you can just tie your hair up as well, that would be great. So I can just see right at the base of the neck here. Okay, so I'll give you a moment to get comfortable and I'll be with you right away. Perfect. So are you nice and comfortable as you are? Great. I just need to pull your top just slightly down there. Might get a little bit caught there. Perfect. So first of all, I'm going to have a very thorough look at your neck and shoulders and also around your face. It's just a general examination. I'll be putting pressure on various parts of your neck, head, and shoulders. I just want you to tell me if you feel any pain, tingling, or numbness in those areas. Then we'll be moving on to some more dynamic movements. So I'll be asking you to move your head, shoulders, and arms in various positions. And again, just let me know if you feel any pain, tingling, or numbness. Does that sound okay? Perfect. So if you just look straight at me, I'm going to come a little bit closer to you. Now, do you feel any pain when I put pressure on this part of your neck? Okay. And here. And here. And here. And here. If I reach around the back, any pain here, here, or here? What about now? Now, and now? Good. If I place my hands on your temples here, do you feel any pain? Here, here. What about here, here, or here? All right. So now, could you shrug your shoulders up and down? Good. Just looking at the symmetry of your shoulders here. Good. Sometimes people have one shoulder that drops lower than the other. A little bit of asymmetry there, which can put a little bit of extra pressure on the neck. So I'm just looking for that. Do you wear any sort of heavy backpacks or anything for work purposes, hiking, camping, anything like that? Okay. And how would you say your posture is from your perspective? So I see right away that your shoulders are slightly asymmetrical, which is putting a little bit of pressure on the neck, but that's an easy fix. So with your back nice and straight, that's good. Just push the shoulders back ever so slightly, ever so slightly. Just drop them both down. Good. And back. Good. See how the back naturally straightens here? You can probably feel a little bit of relief here on the neck. Yes? Good. So that's an ideal posture for you. It's a different story altogether trying to remember to sit like that. But if you're more mindful about your posture, then you naturally will kind of have that muscle memory the more you do it. So I would say whenever you catch yourself hunching those shoulders round, just sit nice and tall, shoulders down and back. That's perfect. So also, some of us tend to jut our chin out, right? Whenever we're walking along, the head sort of comes out and forward, which puts a lot of strain on that neck here. What I do advise is just to drop the chin down ever so slightly. That's it. Not so much that your chin is touching your chest, but just enough that the chin is level with the floor, the shoulders are dropped down and back, and that feels so much better, right? Good. So posture does play a key part in our sort of neck health and the pain that we feel in there, but also how we go about our daily business, our daily activities, how we sleep, what items we use to sleep on, etc. But I'll get to that in a minute. So what I want you to do is just do some very simple movements for me, okay? Now, these aren't meant to be difficult, but sometimes they can be uncomfortable, especially if you're experiencing pain right now. So, are you experiencing any pain in your neck or shoulders or head at this current moment? Alright, well, if you do, then please do let me know and I will stop and we can carry on at another time. Okay, so could you just put your chin down to your chest? I'm going to palpate the muscles on your neck. You just tell me if you feel pain. Perfect. Now lift your chin up, up, up to the sky. Good. Any pain, tingling, or numbness? Alright, good. Now bring your chin back to neutral. Now could you turn your head to your right, like this? Good. Any pain, tingling, or numbness? Alright, bring your head back to center and turn your head to your left, like this. Good. Perfect. Any pain, tingling, or numbness? Alright. Now bring your head back to neutral, and I want you to tilt your head so your right ear tries to touch your right shoulder without shrugging your shoulders up to meet it, if you know what I mean. So shoulders down and back. I want you to try and touch your right ear to your right shoulder. Okay? Any pain, tingling, or numbness? Okay. Now bring your head back to neutral, and I want you to repeat that on the other side. Try to reach your left ear to your left shoulder. Okay? Good. Any pain, tingling, or numbness? Alright. So now we're going to do a little bit of a combined movement. I want you to try and point your nose to your right armpit, so down and to the side. So try and point your nose to your right armpit. Okay? Any pain, tingling, or numbness? Perfect. Bring your head back to neutral. Now try and point your nose to your left armpit. Okay? Any pain, tingling, or numbness? Alright, good. Now, I'd like you to place your hands in front of your chest like this and try and pop your chin down onto your chest. Okay? Any pain, tingling, or numbness? Okay. Now, lift your head to the sky. Good. Pain, tingling, or numbness? And now, side to side. Good. Good, good, good. Now, try and point your chin down to your left armpit and your right armpit. Good. Any pain, tingling, or numbness there? Okay. So now we're going to do all of those exercises again, but I want you to have your hands above your head like this. So, chin to chest, chin to sky. Come back to neutral. Head turned left. Good. Head turn right. And nose to armpit. Nose to other armpit. And tilt your head from side to side. Any pain, tingling, or numbness there? Okay, good. Now, I'd like you to cross your arms in front of your chest here, and I want you to twist from side to side. First of all, with your head following, and then secondly, with your head remaining still, like this. Okay? Yep, in your own time. I'm just going to reach round and hold your neck here. So first of all, twist with your head following. One more time. Good. Now with your head still. Twist. Twist. Any pain, tingling, or numbness? Alright. Very, very good. Alright. So, based from my findings from the physical exam and the questions that you answered earlier, I've come to the conclusion that your neck and head pain are actually being caused by poor sleeping habits as well as poor posture in the workplace. Now, there's a lot of different things that we can do for you today to help manage the pain and also try and prevent it from happening again in the future. So that will involve some exercises as well as recommendations for your workplace and also your sleeping habits as well. So if we start with the workplace habits and also the solutions, I would suggest to invest in a more ergonomic desk and chair, either purchased by yourself or your employer. This is going to help you really have that comfortable posture whilst at work, but I know a lot of people are not in that position to do so, or their employers are a little bit stingy. So there are a couple of different things that we can suggest for you. Having more frequent breaks from your screen by simply standing up for a few minutes and doing some exercises which I will show you in a moment. These literally just take about a minute of your time, so they don't take up a great deal of time throughout your day, and they're very, very beneficial not only for your body but for your brain as well. What I also do suggest is daily use of something called the neck Genic. Now, this is the neck Genic. Now, the neck Genic works with 3 functions. It has a 3-way system of cervical traction, acupressure, and magnetic therapy neck muscle stimulation. It helps gently stretch your neck, increase blood circulation, and release muscular tension. So how you use it is you lay down, you put the pillow under your neck, and there are 2 heights. One is a little bit more extreme than the other, so I would suggest using the lesser extreme one just to start with. You bend your knees, pop your feet slightly apart, put your hands up either side of your head, and just relax into it. You can use this neck Genic for up to 10 minutes every day, but no more is recommended. 10 minutes is just enough. But again, if you're just starting out using this, I would just use it for a minute a day to build up your tolerance to it, because it does take some getting used to if you are a beginner. So this would be perfect for work breaks. If you're on your lunch break and you have somewhere that you can safely lay down for up to 10 minutes, this would be perfect to use then. Again, you can use it anywhere you can safely lay down. So if you're traveling, if you're on holiday, it's a convenient size to put in your luggage and take with you. So that is a solution for every day. So a solution for sleeping is actually to replace your pillows entirely. Now, many times people have one or more pillows that actually can put a lot of pressure on the neck, especially if the neck is tilting forward like this. They can put tremendous strain up the neck. Also, if the pillows are too soft, the neck again can have a lot of pressure put there unnecessarily. So a suggestion would be to use a pillow like this. It's got an ergonomic design, and as you can see, your neck goes into this part here, and your head is cradled in the middle here. The pressure is taken off your neck and head, and your body feels almost weightless. Again, there are two sides. One is sort of flatter than the other side, so it all depends on personal preference. It's 100% premium memory foam pillow, which aligns your spine while you sleep. It is designed for all types of sleepers, so it doesn't matter if you prefer to sleep on your back, your front, your side. This will work for everyone. Again, it's firm, but not too firm. It just has that right softness to just lull you off to sleep. And I use this personally at home, and honestly, it is a life changer. It's so comfortable to sleep on, and truly I have the best night's sleep. So I would definitely recommend something like this. So they are just a few suggestions which are going to help you going forward. And like I say, these things you can trial and error them, you can try them out. If they don't work for you, then please do come back to us, and there are other things that we can explore. Alright, but for now, they're a good starting point. So, let's talk about exercises. Like I say, if you can do these more than once a day, that would be perfect. The more we stretch, the more our muscles are stretched, they become a lot more resilient, and we prevent so many different things that might occur from very tight and tense muscles, further injury, for example. So, these exercises are right on a sheet for you, so you can take them home and remember them and do them every day if you can. So, I'll do them with you so you can follow along. I want you to sit up nice and tall in your chair. Think tall, 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 tall. Good. And I want you to just picture a line going all the way through the center of your body up to the sky, like it's pulling you on a rope all the way up to the sky. chin is level to the floor. The shoulders are down and back. Good. I want you to sit in this position as long as you can, as long as that's comfortable to you. And now I want you to shrug your shoulders all the way up to your ears and down as far as they will go. Okay. You can breathe in when you shrug your shoulders up and release on the way down. Like that. In, up to the ears, down. Exhale. So shrug up, shoulders to ears, breathe in, and exhale, dropping the shoulders all the way down. Good. Breathe in, shoulders to ears, shrug, and down. Good. Again, do these as many times as you want, whatever feels comfortable to you. Now, with your shoulders down and back, I want you to take your chin to your chest as far as it will go. Okay. You'll feel a very good stretch in the back of your neck here. And just hold this position for about 8 to 10 seconds. Once that is done, you can lift back to neutral. And again, chin to chest. And I want you to do that 3 times, okay? Now, when that stretch becomes less challenging for you, you can put a little bit of overpressure on your neck when you do this. So chin goes to your chest. You just take your hand on the crown of your head. Just gently push forward. Just push forward. And that just provides a little bit of overpressure to the neck. Just by bringing the head down, we can truly feel that flexion in the neck muscle there. Alright. So now, I want you to take your head from a neutral position and again tilt the ear to the shoulder as far as it will go, as far as it's comfortable. And you start to feel a stretch in the neck here and the shoulder. Now, to provide again some overpressure, you take the opposite hand to where your head is pointing and place that underneath your chair, or you can sit on your hand. Basically, you want to make sure that this opposite hand is extended fully and anchored to a spot, so holding onto a chair. And now, when you tilt your head to the other side like this, that pressure is intensified, and you can feel that stretch intensifying. Okay. And now to intensify that stretch even further, you take your hand and just apply a little bit of overpressure to the neck here. And that provides a very, very good stretch to the side of the neck. And of course, everything on one side, repeat fully on the other side. Now, the nose to the armpit that we did earlier, we can do again as a stretch. So, placing the nose down to the armpit. Remember to keep your hands anchored to the chair that you're sitting on. Again, you can apply some overpressure to the head to really make that stretch just a little bit more impactful. Now, I want you to interlace your fingers, put your hands out in front of you, and put your head down and up, side to side, nose to armpit, nose to armpit, tilt, tilt. So pretty much everything that we've just done, put your hands out in front. Again, everything that we've just done, but with your hands up to the sky. Down, up, side, side, nose, nose, tilt, tilt. All right. So very, very easy to remember, very easy to do when you're sitting. Standing you can do, of course. I would recommend standing as well, just to get the blood flowing through your body all the way down to your toes. Then once you've finished those exercises, I recommend taking some nice deep breaths in with the shoulder shrug. So in, out. So if you start out by doing these first thing in the morning, as soon as you wake up, and last thing at night before you go to bed, that's a really good starting point. It helps your body get used to these movements and helps your muscles to start getting sort of stretched and used to this movement as well. Then, once you're used to it, you can incorporate these throughout your day. So maybe mid-morning break, afternoon break, and evening break. You can really also do them when you're watching TV, when you're sitting at your desk. They're so versatile and so easy to do. You can do them pretty much anywhere. Alright, so hopefully this has been helpful to you. I'd like to follow up in about a month's time to see how you're getting on and just to check your neck muscles and do another examination on you, if that's alright. Perfect. I'll get an appointment scheduled in for you and I look forward to seeing you then. Good luck and take care.